Never lived that normal life, the American dream, because we're fighting every day just to see if I'm going to wake up tomorrow.
A breast cancer patient lost her insurance, then had her treatment appointments canceled. Aril Ferrara appeared in advertisements for UofL's Brown Cancer Center. And she felt left behind when she couldn't afford out-of-pocket payments.
Well, the hospital's now helping her with her Medicaid application. However, with the stage 4 cancer spread to Ferrara's pelvis and spine, she worries about spending months without the medicine keeping her alive.
Our Ian Hardwick sees how long she could be waiting.
The death is always in the back of my mind now, and it's kind of a weird thing at 25 to be like walking hand in hand with the reaper.
Aril Ferrara's walk began in 2022 when she learned she had breast cancer.
I was a bartender, so I had no 401k, no savings.
None of her 3 part-time jobs offered health insurance, but her parents' plan with United Healthcare let her stay on despite turning 26. Ferrara says United dropped her coverage in July since she wasn't fully dependent on her parents. She married her husband, Bryce Ferrara, 7 months into chemotherapy in 2023.
If I didn't have terminal cancer, it'd be a different story.
After 3.5 years of treatment, she got a call from UofL's Brown Cancer Center.
And so the lady said, well, if you can't afford the out-of-pocket payments, we have to cancel all your appointments. It makes me sad because I thought of them like family. I'm just another number on a chart, but my face was good enough to use as a campaign.
After chemotherapy in 2024, Ferrara agreed to appear in UofL Health advertising.
I am living life thanks to the power of academic research.
The hospital featured her painting kids' rooms at the YMCA Safe Place homeless shelter. Today, she still stands by the care she received.
She gave me the hope that I can live long enough to have a good life with my husband.
Monthly drug infusions keep Ferrara alive, delivered through a device in her chest.
If my blood gets clotted inside of this port while I'm waiting for insurance, that's another thing that could kill me. If my cancer grows while I'm waiting for insurance, that's another thing that could kill me. Right now it feels like I'm fighting paperwork instead of doing anything else.
Once Ferrara went public with her struggle, UofL Health spokeswoman Heather Fountain said the canceled appointment came up because of a, quote, miscommunication with the scheduler. Now the hospital is working with Ferrara on an Indiana Medicaid application. According to Indiana's Family and Social Services Administration, it could take up to 90 days to complete.
I feel like I have the body of a 60-year-old.
The 90-day timeline is for people like Ferrara collecting disability, double the regular 45-day period. Even as she struggles to hold a brush, Ferrara's selling her paintings at the Unfair Art Show at Old Louisville's Mag Bar this October.
And there's still reasons to laugh and love and be happy. And it is really scary when, you know, I'm literally almost out of my heart medication and the treatment that I'm on really affects my heart, and I don't know how I'm going to pay for my next prescriptions.
A question that could take months to answer. Reporting in Louisville, Ian Hardwick for WHAS 11 News. On your side.
Ferrara's gone through an interview with Medicaid to determine if she's eligible with her disability. Federal data shows Indiana completes 67% of its Medicaid applications within 15 to 30 days.
And according to the same data set, Kentucky processes 62% of Medicaid applications in less than 24 hours.